Africa's leading health think tank, the Africa CDC, now says that there is no cause for alarm over the latest reports of blood clots in recipients of the Johnson & Johnson COVID-19 vaccine. The Continental Public Health Agency says that the cases are extremely rare and the benefits of the vaccine far outweighs the risk. The use of the vaccine has, however, been paused in the United States over what officials term as an abundance of caution. We begin the bulletin tonight with Mashirima Kapombe, who reports on the developments that came as the Kenyan government began the refund process for people who had paid for the now rejected Sputnik 5 vaccine.
Amid a supply crisis of the AstraZeneca vaccine, the African continent was already looking for an alternative in the US-manufactured Johnson & Johnson vaccine. Under the plan, the African Union had announced plans to import some 400 million doses of the jab to cushion the continent from global supply constraints. The Africa Center for Disease Control now says the decision by the US health regulator to halt the administration of the vaccine was simply precautionary and will not affect Africa's plans.
At the moment, we do not have any reason to advise for pausing or stopping of the Johnson & Johnson vaccination process because all evidence is showing us that it is working well. There are no serious side effects that have been seen that are in significant numbers.
U.S. federal health agencies on Tuesday called for an immediate pause in the use of the vaccine, citing a rare blood clotting disorder in 6 people out of a total of nearly 7 million people who have received the vaccine, translating to 1 in more than 1 million people. Out of the 6 reported cases, 1 person has died while another is in critical care. The maker of the vaccine, Johnson & Johnson, saying in a statement that no direct link has been established between the adverse symptoms and the vaccine. The Africa CDC saying the benefits are still way greater than any potential risk.
Remember, Johnson & Johnson is already in use in South Africa. And the results that are coming from South Africa are very encouraging, and we will continue with our plans to import Johnson & Johnson into Africa.
A similar debate ensued in Europe in the last few days over the AstraZeneca vaccine, which is currently being administered in Kenya. But the specialized health institution says the side effects are not out of the ordinary.
The reaction that we get, whether it is pain in the area of injection, whether it is fever, whether it is some level of tiredness, it is a testimony that the vaccine is actually working. Because remember, the vaccine is supposed to have your body to produce antibodies that are going to be used to fight the virus if at all you ever get exposed to it. Now, that process of producing antibodies means that the body has to generate some side effects.
The organization that works under the African Union is, however, encouraging active reporting of all the side effects experienced for better management and collection of data. Kenya is among several African countries expecting the Johnson & Johnson vaccine to boost its vaccination drive. The developments came as the Ministry of Health initiated a refund process for those who paid for the now suspended Russian vaccine Sputnik 5 but did not receive the jab. The government is assuring those who got the first shot that they will be guaranteed the second one within the recommended timelines. Mashirima Kapombe, Citizen TV.